Hola a todos, and welcome to The Explainer. I am absolutely thrilled to have you here today because we're about to explore a document that honestly feels like it's straight out of a sci-fi movie, yet it's grounded in incredibly real, rigorous science. Today we're opening up the declassified blueprint for a technical white paper on a molecule called apoquadina 3. This was authored by Lázaro López Paz in April 2026 out of Barcelona, Spain. And, this isn't just another dry scientific paper. It's a literal blueprint for a completely new way to treat hereditary cardiovascular diseases. We're going to break down exactly how this molecule works, point by point, and why it has the potential to completely flip the landscape of global medicine on its head. Okay, let's dive right into this. 85%. That is just a staggering number when we're talking about human biology. So what does it mean? Well, it represents the massive, robust reduction in a really dangerous protein called lipoprotein A, or LPA for short. Now, for people with a genetic predisposition to certain cardiovascular diseases, LPA is this stubborn, silent threat just circulating in their bloodstream. Historically, it's been incredibly difficult to treat, but this revolutionary oral molecule we're talking about today can actually slash those dangerous protein levels by 85%. It is a total game changer, and we're going to unpack exactly how it manages to pull off this phenomenal result. Here's our roadmap for today. We're going to move through 5 clear sections. First, getting to know apoquadina 3. Then, how it blocks the disease. Third, safety and smart design. Fourth, goodbye to injections. And lastly, open and universal science. Section 1, getting to know apoquadina 3, the small oral molecule. So let's introduce the absolute hero of our story here. The source document describes apoquadina 3 as a massive breakthrough in targeted molecular pharmacology. But what does that actually mean for us? Basically, scientists have engineered a tiny, incredibly precise key that fits into a very specific biological lock to target the root cause of cardiovascular disease. And here is why this is making such huge waves. For the longest time, patients dealing with high LPA levels didn't have any effective options they could just swallow with a glass of water. They've been totally reliant on expensive, complex biological therapies that literally have to be injected. This blueprint was designed from the ground up to be a generic, oral alternative. It's engineered to completely end our reliance on injectables. Section 2. How it blocks the disease. The mechanism of action. So how exactly does a simple pill achieve an 85% reduction in a dangerous protein? Let's zoom way in to the microscopic level, zero jargon style. Think of your body like a factory that is mistakenly churning out a dangerous product, that bad LPA protein. Step 1, apoquadina 3 acts like a highly trained inspector. It locates the exact instruction manual for that product, specifically a region called the mRNA-5 UTR. Step 2, instead of destroying the manual, the molecule simply ties a very specific structural knot in it. The white paper refers to this as stabilizing the G quadruplex, or G4. Step 3, when the body's protein factory worker, the ribosome, tries to read the manual, it hits this knot and gets completely stuck, just a total roadblock. Which brings us to step 4. Because the worker is stuck, production comes to a grinding, screeching halt. The bad protein is simply never synthesized. Boom. Now, you might be wondering, hold on, is it actually safe to mess with my genetic instructions? Well, the sheer elegance of this targeting is fascinating. The blueprint clearly shows a massive distinction. Apoquadina 3 only interacts with RNA. Those are just the temporary, single-use instructions your body prints out on the fly. It has absolutely zero interaction with your DNA, which is your permanent genetic hard drive. This incredible precision, discriminating RNA over DNA, guarantees what the author calls total genomic safety. You get the 85% reduction without ever laying a finger on the permanent source code of your body. Section 3. Safety and smart design. Incisive molecular engineering. We know the engine works, but let's do a quick safety inspection on how this molecule was physically optimized. The white paper lays out some crucial technical specs. It's got a specific core, thieno-3,2-G-quanoline, and a super tight affinity of 45 nanomolar. It also acts as a prodrug, meaning it quietly waits in your system to be activated specifically by your liver, right where it's needed most. But look at that last point, zero cardiac toxicity, or null HERG. In the past, similar molecules had this really nasty habit of interfering with the heart's electrical system. But the author used some seriously incisive molecular engineering to strategically shorten the molecule's side chain. That one genius little adjustment completely eliminated the heart toxicity, making the drug perfectly safe for long-term chronic use. Okay, I know exactly what you're thinking. This giant string of random letters and numbers looks like a cat just walked across the keyboard, right? But actually, this is a SMILES chemical identifier. It is the exact, precise chemical key and digital representation of apoquatina 3's structure. The white paper includes this right out in the open so that any scientist in any laboratory anywhere in the world can run computer simulations, validate the drug's affinity, and verify the safety data for themselves. It is absolute 100% transparency. Section 4. Goodbye to injections. Accessible precision medicine. Let's zoom back out from the microscopic chemistry and look at the real-world application for actual people. This is a massive paradigm shift. The old method for treating these severe genetic cholesterol issues relies really heavily on biological injectables. They are insanely expensive, they require a strict cold storage supply chain, and they often force patients to visit specialized hospitals just to get their meds. It's just a logistical nightmare for everyone involved. The new method? Utilizing the apoquatina 3 blueprint, it replaces all of that with a simple daily oral pill. It is highly disruptive because it takes cutting-edge genetic medicine out of the ivory tower clinic and puts it right into your medicine cabinet at home. Section 5. Open and universal science. Healthcare sovereignty and equity. This brings us to what is perhaps the most mind-blowing part of the entire project. The author, Lázaro López Paz, didn't patent this molecule to lock it away behind massive corporate walls. The entire blueprint is released under a Creative Commons CC BY 4.0 free license. Yep, it is totally open source. Why? Because a small chemical molecule like this can be easily and cheaply manufactured by generic labs all over the globe in a completely decentralized way. The explicit goal here is to combat medical inequality head-on. It's intentionally designed to close the gap so that patients in developing nations have the exact same access to life-saving cardiovascular treatments as those in the wealthiest countries on Earth. I want to just take a second to share the author's exact closing words from the white paper, towards a medicine based on conscience and universal access. It is such an awe-inspiring, genuinely optimistic vision for the future of healthcare, isn't it? It completely redefines what pharmacology can be when we prioritize human life and global equity above absolutely all else. Which really leaves us with this final, absolutely vital thought. We have the blueprint. We have the proven mechanism, the safety data, and the open source key for decentralized manufacturing. So if the formula is free, what stops us from curing the world? I hope this explainer has sparked your curiosity about the incredible potential of apoquatina 3 and the open science movement. Thank you so much for joining me today, and as always, keep asking the big questions.